Vet Pharma 322, drugs acting on respiratory system. Learning objectives. List the perspective mechanism of respiratory system. Describe the use of decongestants in respiratory disease. Describe the action of antitussives and describe the actions of bronchodilators. In the respiratory system, it consists of structures that carry air in and out of the lungs and has a passageway that is interspersed with the mucus-secreting cells called goblet cells. And this helps in the humidification of the area of the nasal cavity and the warming of the inspired air. In the pharmacology of respiratory system can be simplified by its general goals: the control of secretion, control of reflexes, and maintaining the airflow to the alveoli. In control of secretions, it may be reduced by decreasing their production, and methods are also aimed at making the secretion less viscid through the use of expectorants or through nebulization of mucolytics. And for the control of reflexes, coughing may be suppressed by intervention of antitussive agents, and sneezing is controlled by removal of the foreign stimuli. And bronchospasm may be controlled with bronchodilators and corticosteroids. While in the maintaining the airflow to the alveoli, it performs in various ways. First, reversing bronchoconstriction, then removal of edema or mucus from alveoli and air passages, then and providing oxygen therapy. And intermittent positive pressure ventilation and other ventilation strategies are often used in humans and may have application in selected animals. For the categories of the respiratory drugs, in decongestants are sympathomimetic drugs that stimulate the alpha-adrenergic receptors in mucous membranes and cause local vasoconstriction. And in topical decongestant, short-acting topical agents include phenylephrine and phenyllopropanololamine. Phenyllopropanololamine, which are common ingredients in over-the-counter nasal sprays. Some topical decongestants are particularly long-acting, such as oxymetazoline and silometazoline. And decongestants are systemic systemic decongestants in human medicine over-the-counter. Formulations for colds and allergies have contained ephedrine, the isomer pseudoephedrine, and or similar drug, the phenylpropanolamine.
H1 antihistamines or diphenyl diphenhydramine, dimenhydrinate, chlorpheniramine, and hydroxyzine. For the sympathomimetic drugs or the alpha receptor agonists, we have the ephedrine, pseudoephedrine, and phenylephrine. Antitussives are drugs utilized for suppressing a non-productive and detrimental cough. First is peripherally acting. It includes the anti-inflammatory drugs, mucolytic, and bronchodilators. The central-acting opioid and non-opioid reduce the sensitivity of the cough center to afferent stimuli. The opioid cough suppressants may cause sedation, nausea, and constipation. Morphine is the prototype of an opiate or narcotic analgesic with good binding affinity for the muscarinic and kappa opiate receptors. Morphine can be administered at low doses that produce antitussive effects without causing analgesia and sedation. Codeine, for dogs and cats, one of the most effective with an antitussive effect that is much greater than its analgesic effect. The butorphanol has 100 times more effective as an antitussive than codeine. It can be given orally or parenterally to dogs and cats. It has a short duration analgesia but longer sedative effect and minimal respiratory depression with a half-life of 1.7 hours. The hydrocodone, commonly used in the dog, it is more potent antitussive than codeine. The dextromethorphan, a system a semi-synthetic opioid that is found in many over-the-counter human cough preparation, but its efficacy in animals is not documented. Bronchodilators are the beta-adrenergic receptor agonists. The beta-adrenergic receptor agonists have a beneficial effect in the treatment of some airway diseases. In animals, they are used for airway disease, allergic bronchitis, and similar disease such as feline asthma and recurrent airway obstruction, formerly called chronic obstructive pulmonary disease or HIVS in horses. For the mode of action, bronchial smooth muscle is innervated by beta-2 adrenergic receptors. Stimulation of beta-2 receptors leads to increased activity of the enzyme adenylate cyclase, increased intracellular cyclic adenosine monophosphate, and relaxation of bronchial smooth muscle. Stimulation of beta-2 receptor Stimulation of beta receptor activity on mast cells decreases release of inflammatory mediators. The beta receptor on mast cells produces a stabilizing effect, and there is a little effect on the other inflammatory cells. The increased mucociliary clearance. There is some evidence that beta-adrenergic receptor agonists increase mucociliary clearance in the respiratory tract. The clinical significance of this effect has not been established.
Short-acting, non-specific bronchodilators. Epinephrine or adrenaline. Epinephrine stimulates alpha and beta adrenergic receptors, and it produces pronounced vasopressive and cardiac effects. Epinephrine is considered the drug of choice for the emergency treatment of life-threatening bronchoconstriction. The nonspecific stimulation of other receptors and its short duration make it unsuitable for long-term use. Duration of action is short, less than 1 hour. For the norepinephrine or the levetiracetam, this drug has similar beta-1 effects as epinephrine, but fewer alpha-1 and beta-2 effects, and therefore is not suitable for respiratory therapy. For the isoproterenol or isoprel, isoproterenol is a potent beta receptor agonist. It is selective for beta receptors with little alpha receptor mediated effects, but the cardiac effects make it unsuitable for long-term use, and it has been administered by inhalation or injection. It has a short duration of action, less than 1 hour. For longer-acting beta-2 specific drugs, to avoid the adverse cardiac effects of beta-adrenergic agonists, drugs have been developed that are more specific for the beta-2 receptor, and these drugs are preferred for repeat use or long-term use. And these drugs are also incorporated in some of the metered dose inhalers used to treat bronchoconstriction. And terbutaline is similar to isoproterenol for its beta-2 activity, but it is longer action. but it is longer acting 6 to 8 hours. It may be injected subcutaneously to relieve an acute episode of bronchoconstriction. Terbutaline has been used in horses to treat recurrent airway obstruction, and it is not absorbed after oral administration in horses. Therefore, injectable preparations must be used. And for the metaproterenol is similar to terbutaline, but the duration of action is shorter, at least 4 hours. It is available as 10 and 20 milligram tablets and 2 milligram per ml oral syrup. The dose in small animals is 0.325 to 0.65 milligram per kilogram. For the albuterol, is similar to terbutaline and metaproterenol in its action. Doses used in small animals are 20 to 50 microgram per kilogram, up to 4 times per day. It is available as 2, 4, and 5 milligrams tablets and 2 milligram per 5 ml syrup. And clenbuterol is used in food animals and is illegal. Clenbuterol has been used for the treatment of RAO and COPD. Compared to other beta-agonists, clenbuterol has lower clinical efficacy because it is only a partial agonist and has lower intrinsic activity. The duration of effect is 6 to 8 hours, and adverse effects in horses include sweating, muscle, tremor, restlessness, and tachycardia. And in clenbuterol in livestock, beta-2 agonists have been used legally as repartitioning repartitioning agents. A repartitioning agent redistributes nutrients away from adipose tissue in favor of muscles. Deaths in humans have been reported as a result of eating beef liver contaminated with clenbuterol residue. In the US, clenbuterol residues have been highest in show animals. There are also in there are also is evidence that clenbuterol has been used for muscle building in human athletes.
Inhalant formulation, beta-agonists. The use of aerosols has become more common in animals because adapters are available to allow for use by animal owners. In horses, masks are available that allow a metered dose inhaler to be used. The Aeromask or Trudel Medical International and Equine Inhaler from Equine Healthcare are two such masks. For cats, the AeroCat chamber has also been used to deliver these medications. Albuterol or Torpex. It is an aerosol formulation in pressurized canister and delivered via specialized nasal delivery valve. In 2002, albuterol sulfate was approved by the US FDA for horses indicated for relief of bronchospasm and bronchoconstriction associated with the recurrent airway obstruction. In horses, doses of 360 or 720 microgram delivered by aerosolization caused significant bronchodilation. The same author has administered Forbuterol at 600 microgram per horse with good results. For small animals, the metered dose inhaler to deliver albuterol in people has been adapted for use. An inhalation chamber is used to deliver the drug. For the adverse effects from the beta agonist, The most common adverse effects from beta agonists affect the cardiovascular system, which is tachycardia, and skeletal muscle, which is muscle tremors. Cardiac effects, such as rapid heart rate, palpitations, and tremor, can be prominent with beta-1 agonists and can be reduced by beta-2 agonists at high dosage. When high doses of beta agonists have been nebulized to horses, they produce muscle twitching, sweating, and excitement. Beta-2 receptor agonists also inhibit uterine motility and should not be used late in pregnancy. High doses of beta-2 agonists also can produce hypokalemia. Done.
That's all.